Yeah, I understand.
Yes, yes, yes.
So, with your permission, shall we start, ma'am?
Yes, yes,
Yes.
yes, yes.
Yeah, okay, ma'am. Uh, Good evening, doctors. I'm Dr. Someshwar from Shield, and I welcome you all on behalf of Shield. Thank you very much for joining today's webinar. I kindly request all the participants to post their questions in the comment box, and at the end of the webinar, we will have a short Q&A session with the expert comments. So, good evening, all the doctors. Thank you for joining today's webinar.
Thank you, Dr. Someshwar.
Uh, Sorry, ma'am. Uh, yes. Yes. Good evening, Dr. Ritu Santwani. Today, our speaker is Dr. Ritu Santwani, and thank you for accepting our invitation. And it's an honor to introduce the madam today. So, actually, madam doesn't need any introduction. She is a director at Sham Well Women Clinic, Pune, and she is a obstetrician and cosmetic gynecologist and IVF infertility specialist and a honorary professor and in obs and gynec in WIMS Medical College, Gujarat, Gajrola. Sorry, yeah, and she's having 20 years of experience in the OBG services and specialized in cosmetic gynecology as well as test tube baby and in each and every aspect of infertility and provide comprehensive services in IUI, IVF and assisted hatching, egg donation, embryo donation, surrogate motherhood, male infertility, natural infertility treatments, semen banking, embryo freezing, sexual and psychological problems along with the cosmetic gynecology treatment, PRP therapy, and try to give moral and emotional support to our infertility patients. And madam has her academics, MBBS from the GSVM Medical College Kanpur and MD in OBG from King George Medical College Lucknow, and she completed her FICOG ART course for clinician from NUHS Singapore and postgraduate diploma in clinical cosmetology and medical cosmetology and RCOG associate from London and reproductive genetics and Foxy Gestosis certified and Indian Academy of OBG honorary fellow for improvements of women's health. And madam, when coming to the her key honorees and participants, she have participated in various international and national conferences. And to her, she had many publications in the many conferences as well as in the uh, various
Dr.
journals.
Someshwar, I think that
Yes,
much is enough. My teachers are here. Huh?
ma'am. Yes,
But it
madam.
is good to listen about you, Ritu.
Yeah,
Thank
it's
you.
nice
Thank
to
you.
listen. We'll know
Yes,
more
ma'am.
about you. Continue.
No, no,
Yes, ma'am.
that's okay. That's okay, ma'am. That's okay. Huh?
Okay.
Dr.
Yes, ma'am.
Someshwar. Yeah.
Yes, ma'am. And
Will
it's
you?
always an honor to introduce you, ma'am. And with this, we'll go to introduction of our chief guest, Dr. Yashodhara Pradeep. And
Yeah.
over to Dr. Ritu Santhan.
Yeah. Please. Yeah. Please display the biography of ma'am.
Yes.
Yashodhara ma'am's biography. Please display. Dr. Someshwar, please
Yeah, yes,
display.
ma'am. Yes,
Yeah,
ma'am.
yeah,
Yes,
yeah.
yeah.
So, friends, a very good evening to all of you. So, thanks to each and everyone who has joined here. So, before I start today's talk, today my teacher, Dr. Yashodhara Pradeep, madam, is here. So, I want to start with these two lines. Guru Govind do khade kake lagu paye, balihari Guru apde Govind diyo bataye. So, many thanks, dear ma'am, and a very warm welcome to you for accepting my invitation. So today I am having very special guest with us. The chief guest is Dr. Yashodhara Pradeep ma'am, and our the guest of honors is Dr. Veera Loya ma'am, President Gwalior Society, Dr. Supriya Jaiswal madam. Madam is secretary elect for Patna Society, and Dr. Rajiv Vyas sir, a very renowned figure of the Gujarat. Very warm welcome to all of you. With this, I am starting with the introduction of my teacher, Dr. Yashodhara Pradeep ma'am. For us, the ma'am is a very well-known teacher who is always ready to guide us. Ma'am is Professor and Head OBGYN, Dr. Ram Manohar Loya, Institute of Medical Sciences, President of Lucknow Ops Gynec Society, Vice President elect Foxy. So, ma'am, many congratulations for that. Vice President IMS 2018, various positions in IMS chairperson credentials in menopause practitioners, reviewer in Journal of Midlife Health, founder member of Lucknow Menopause Society, Ma'am has received various awards and honors: Best Teacher Award for KGMU 2015, Best Paper Award AICOG 2014, Chairperson Family Welfare Committee 2016 to 18. So a very, very warm welcome to you, ma'am. Yashodhara ma'am, very warm welcome. Uh, Dr. Someshwar,
Yes, ma'am.
yeah,
Yeah.
please introduce our guest of honors. Then we will take a few lines with everyone. Yeah.
Yes, ma'am. So coming to today's our first guest of honor, uh, Dr. Supriya Jaiswal. Yeah, actually, Madam Dr. Supriya Jaiswal is a chief consultant at Dr. SM Hospital, partner specialist in Government Hospital, Bihar. And she is at present she is a treasurer for POGS 2019 to 20, and she is the chairperson for Adolescent Health Committee POGS and a communicator for ISO PARB National and executive member for ISO PARB Partner Chapter, and she is a member for Adolescent Health Committee FOXY and Young Talent Promotion Committee FOXY, and she is a member for Genetic and Fetal Medicine Committee FOXY, and she is a member for Public Awareness Committee FOXY, and she is a treasurer for IFS Partner Chapter and a life member for ISAR and IMS and IFS. And she's had special awards and recognition from Dr. MP John Gold Medal, and also she had from Dr. GVL and Murthy Award for the best paper in the OBG, and Gold Medal for best short paper in gynecology. And she is a recipient of numerous certificates and awards. And her field of special interest is high risk for pregnancy and preventive oncology. So coming to our next guest of honor, Dr. Rajiv Vyas. Uh, Dr. Rajiv Vyas is a practicing obstetrician gynecologist, and he is a rural obstetrician and a guest professor in CNKH Medical College, Vayara, Gujarat. And he is an ex-president Surat Society, and sir is a ex-vice president at Gujarat State IMA and organizing co-chairman Gujarat State Gynae Conference 2016. And he is an active social worker, and he is an active BJP political worker, and he is a Lions International Club member. And our next guest of honor, Dr. Veera Lohia. Dr. Veera Lohia is a senior consultant at Janaki Hospital, and she is a president at GOGS Gwalior OBG Society and a secretary at AMPOG and a vice president at IMA in 2018. And she is a co-founder member of Health Plus Club. She has chaired many sessions in AICOG, and she is a corporate in 1995, and she is a member of Lions and Rotary in Inner Wheel Club. Yeah, and with this, I finish my introduction of the our respected speaker, chief guest, and guest of honors. And I thank all of us, all of you all, ma'am, for joining today's webinar. And with this, over to Dr. Ritu Santwani for the today's webinar.
Yeah, thank you. Thank you so much, ma'am. So, ma'am, before we start, first we will take blessings from our Yashodhara, ma'am. Ma'am, few words from you.
Yes. Good evening, everyone. It's my pleasure and honor, Ritu,
Thank you, ma'am.
to have been invited as a chief guest by you, and my honor to be with my fellow people, Dr. Rajiv Vyas. I know, namaskar sir, phone पे बात हुई है आपसे. We have talked on the phone. Dr. Veera Lohia from the Indore and
No,
Supriya
Gwalior,
from
ma'am.
Patna.
Gwalior.
No, Veera Lohia from Gwalior.
Yes, sir.
Yes, and
Yes, ma'am.
Supriya from Patna. And Dr. Someshwar to organize this program. It's really my pleasure to meet all of you and to bless my student Ritu Santwani, who was a very bright student when she was in KGMC, KG Medical College. At the moment, I'm in Ram Manohar Lohia Institute of Medical Sciences, but I was and I'm going back to King George Medical University only in end of this month. At the moment, I'm in UK with my daughter.
Okay.
So it's a pleasure to introduce, to say something about Ritu. She's a very bright student, and now she has progressed to such a wide, such a popular person, and she is very competent IVF specialist. So I really feel very proud of her that she's the one, because I always say to my students, now this is not the time when you are doing everything. When you go out from this college, because here you have to do everything, so you must choose what you want to do, because now there's so many branches are there and they all are flourishing. So she has chosen the infertility because at that time it was a very new feature. Now the probably oncology is becoming better option, but at that time IVF was growing, infertility was growing, and this IVF this thing hospitals were also coming up. So she has chosen a very right branch of her time, and she is doing so well. I keep on meeting her in the conferences and the Pune, and I feel very proud of it that my students are doing so well. So I'm very proud of you, and thank you once again for inviting me as a chief guest. It's a big honor. I am really thankful to you, Aritu. And
Thank
God
you.
bless you. May God fulfill all your dreams, you success in each and every of your endeavor. Thank
Thank
you.
you. Thank you. Thank you so much, ma'am. Pleasure is mine. Now, Veera, ma'am, over to you.
Thank you, Dr. Ritu. Thank you for making a part of it. We're so the London doctors are also there. So good evening to Dr. Pradeep, Dr. Rajiv, Dr. Supriya. I'm really thankful to Dr. Ritu, and I appreciate the work you are doing. I keep on watching you on Facebook, and every day you are putting some or the other. You are coming up with problems, and you're educating the masses, and I think it's the best thing that you are doing, and by this you are educating them also, and you are learning yourself also. So I mean, a superwoman, I tell you, and you have chosen a very pertinent topic today. Really, the lady, the girls are getting married late because they become very career oriented. Even my daughter married late, and then she had all these problems. She had to go under IVF, and I really think oocyte quality really suffers if you get married late, because I believe ovaries are programmed to release eggs for till some age, and if your age it surpasses, then it really poses problem. So you have taken a very good topic, and I think there are many reasons to it which you will throw light. Thank you for making a part of it. Thank you so much.
Thank you. Thank you so much, ma'am. Veera, ma'am, for your blessings. Yeah, over to you, Rajiv sir. A very warm welcome. Rajiv sir is very, very friendly, always a best guide, and always very friendly, always ready to boost us. Rajiv sir, few words from your side. Sir, you have to unmute yourself. Unmute, sir. Rajiv sir, you have to unmute yourself.
Oh,
Yeah, yes.
Yeah, now we can hear.
Now
now
we,
you can hear. Yeah.
yes, yes,
Sorry.
yes. No.
Very good evening to everybody. I'm thankful, Dr. Ritu, for making me a part of this webinar as a guest of honor. I'm a rural practitioner, 50 kilometers from Surat, a small town, and doing my best. And the topic you have chosen to improve oocyte quality is a basic thing. You get this semen donation frequently, but it is difficult to get oocyte donation. So it is better to improve oocyte quality. That's good. Topic is very good, and I'm happy to share with Dr. Yasodharaji, the Vice President-elect. She rightly told we were on the phone when she was on election, and I confess that I have to work for her also. I help her also, and my other dignitaries on the dais. I also happy to share dais with you people, and best of all luck, Ritu, and thank
Thank
you
you.
very much again choosing a simple guy from a rural area of India. Thank you very much.
Thank you, sir. Pleasure is mine for accepting the invitation. Yeah, over to you, Supriya ma'am. Supriya ma'am, are you there?
Yeah. A very good evening to all of you. And Dr. Ritu, thank you for inviting me as guest of honor. I feel blessed and I'm really very happy. First of all, I would like to say pranam to Yashodhara Pradeep madam. You are very senior. Congratulations again. I've been seeing your flyers and the election days. Very nice to see or you've been elected. And Dr. Veera Loria ma'am, and Dr. Rajiv Vyas sir, and Ritu. Dr. Ritu, you are wonderful. You are such a loving personality. Wherever you meet her, she's warm. She meets you and she makes you feel special. She makes you feel, yeah, it's nice to meet people in the conferences. You remember, Ritu, the last time we met long back. Now it has become years because since the COVID times, it was very nice, and I love to come to your show. I'm very happy to see the topic you have chosen because it is a very difficult one, and people want to know the simple ways how to improve the research qualities. So now over to you.
Yeah.
Thank you.
Thank you. Thank you.
One thing, Ritu, I want to add for you. I
Yes.
remember I forgot to tell that Dr. Ritu is very hardworking, very intelligent, very social, and very enthusiastic and very warm. When we meet in the conference, our welcome is very nice, and we enjoy meeting her. Okay, Ritu.
Thank you.
Yes.
Thank you. Thank you so much, sir. Uh, Yashodhara ma'am is saying something. Ma'am, you have to unmute. Ma'am, you have to unmute.
Yes, I am also a lion person, and I see that many of you belong to Rotary and Lion.
Yeah,
And
Yeah.
Dr. Rajiv is from Lion, and Dr. Veera is from Rotary. So it's
Rotary,
really
Lion, both.
pleasure
I'm
because
member of both.
working with the NGOs also gives you so much satisfaction and so much
yeah,
information.
definitely. Yes, yes, yes.
True.
Yes.
True.
And about the topic oocyte quality, I just want to share one thing that these days, as Dr. Veera Roya very rightly said, that people are becoming a career minded, and career also is taking long time because everything has got exam. So career takes a long time. So by the time they marry and decide for the family, it becomes long. But what I have learned that menopause is not a genetic, till now it has not been proved, but it seems to be genetic. And it is been said the one can get from the history by just by asking at what time your mother had the menopause. So you know that this girl is also going to have a menopause. So those girls who comes to me that what is the right age for me to plan a pregnancy or this thing. So I just ask them one question. They say, how, ma'am, it is related to this? I say, because it is the egg quality which you would require at the end of the day to have your own child. And but this is one thing which I have learned somewhere, and I find it because it is a genetic. You see, around that time only the daughters also going to get the menopause. So it is very important to have this history. So in fact, I wanted to do a one project also on this, but anyhow, we'll see. So
Okay.
over to you, Ritu, and we
Yes.
are
Yes.
looking forward to
Yes,
listen
ma'am.
to you. It's a very
Yes.
difficult topic, oocyte quality, and very burning topic
Yes, ma'am. Yes.
because many people come and ask about you that when we can plan pregnancy
True.
and what is going to be the outcome.
True. True.
So
So, with the
we are all
permission,
looking forward to
yes, yes,
listen to
yes,
you. Yes.
yes, ma'am. So, with the permission of Honorable Chief Guest and our guest of honor, I am starting sharing my screen. Yeah,
Sure.
yeah, yeah. Yeah, slide is not moving. Yeah. So, friends, today I'm going to discuss a very important topic, how to improve the oocyte quality. So, before I start my talk, today is a Kartiki Purnima, and we say it's a very, very auspicious day. So, before I start, and this is the evening time, so I'm starting by worshipping my goddess Mata Rani. That this second wave of corona has come. So, protect all of us. Ya Devi Sarva Bhuteshu Chikitsa Rupen Sansita Namastasyai, 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 Namo Nama. So, how to improve the oocyte quality? Yeah. So, as we all know, this management of poor responders is a very, very most common challenging task in the reproductive medicine. And this oocyte quality is defined as the ability of an egg to complete the meiosis and undergo fertilization to produce a healthy embryo, which has the potential to progress to the blastocyst stage in vivo or in vitro, and or implant to produce a healthy offspring. So now what is this oocyte quality? The potential of the egg to be fertilized or to make a good quality embryo or to lead a pregnancy are all the things that can be rooted back to egg quality. Egg quality refers to whether an egg is chromosomally normal, euploid, or abnormal, aneuploid. Oocyte quality impacts early embryonic survival, the establishment and the maintenance of pregnancy, fetal development, and even the adult disease. As we can see in the oocyte morphology, the polar body, the zona, the perivitelline space, and the egg cytoplasm. So, what is the importance in this oocyte? The spindle of the spermatozoa, which is responsible for the PN and assembly after the first mitotic division, and spermatozoa DNA starts its expression on the second or third day of the development. Oocyte organelles are responsible for the rest of the mitotic divisions. Oocyte mitochondria represents the energy supply of the embryo until its implantation. So we know in this what is the importance of oocyte and how this embryogenesis take place, in which the actual volume of the embryo until the blastocyst expansion, the protein synthesis is responsible for the embryo development from the second cell division, organelle formation and distribution that gives structure, energy, and proper metabolism to the embryo until its implantation, membrane structure and transport mechanism, mitosis machinery, and 50% of nuclear DNA and mitochondrial DNA. We can see that how common is how is the normal oocyte and what are the abnormalities can seen: granular, refractile body, ovoid shape, fragmented, thick zona, vacuole, or smooth endoplasmic reticulum, or irregular zona, or large perivitelline space, or fragmented polar body, or large polar bodies. So the test for the poor egg quality, I think all of you agree with me, either with AMH or day 2 or 3 FSH and the antral follicle count. So the intrinsic factors which affect the influencing the oocyte quality are, as per reported, the polycystic ovaries or what the stimulation protocols have been used, endometriosis and advanced maternal age. So in this, in the intrinsic factor only, a prolonged folliculogenesis is an hyperandrogenic ambience due to an exaggerated response of the granulosa cells to FSH stimulation and to the androgen synthesis, which leads to a poor oocyte quality and lower implantation rate. So the molecular abnormalities in the oocytes from the woman with PCOS revealed by microarray analysis, a different expression study has been supported by so many journals. A different expression of genes related to the meiotic or mitotic cell cycle suggested that the defects in the meiosis or early embryo development could lead to a poor embryo development in the PCOS cases. So the in this intrinsic factor only, the what has been reported by studies, the endometriosis does not play a negative role in the implantation of the oocyte donation cycles. So no significant difference on the chance of achieving a pregnancy and live birth rate after ART between the patients with or without endometriosis. Uh, in this, the studies have also been reported by Garrido that follicular involvement in endometriosis cases affects the oocyte quality and thus the embryo development. Again, there is one more study has been reported by Zhu et al. That oocyte coming from minimal and mild endometriosis patients have decreased oocyte quality due to impaired mitochondrial structure and function. So it has been concluded by Hosman et al. That endometriosis seems to affect the oocyte number and quality more than it affects in the endometrium receptivity. And I think all of you agree with me on this, the impact of the maternal age too. With the increasing maternal age, the decrease of the fertility and increase of the miscarriage rate and increase incidence of the prevalence of the aneuploidies has been reported. So the intrinsic phase, how it is affecting in the oocyte with the advanced maternal age, the reduced mitochondrial number and decreased activity. And so in the metaphase 2, disrupted meiotic spindle, which causes the insufficient energy available to form or maintain the meiotic spindle, chromosome misaligned or scattered, aneuploidy, poor embryonic development, implantation failure, miscarriage, and birth defects. Whether in the comparison, the normal, where the meiotic spindle which is formed after the oocyte receives a signal for ovulation, resumes the meiosis and arrests at metaphase 2 stage, which is the ATP driven process which needed for the equal chromosome segregation. So this diagram also depicts the same. So here the this chart is reflecting that how with increasing age the chances of the abnormal embryos are increasing. Again, this study has been supported by the Templeton and study, which is published in the Lancet journal too. Again, this study have been published that how the age factor less than 38 years and what the incidence has been reported in the more than 38 years. So how this affects the in the abnormal embryos reported less than 38 years, the 69, and more than 30 to 84%, the clinical pregnancy rate is reported, and how it affects the implantation and miscarriages. So what are the ovarian changes with the aging? We can see the poor ovarian response. Why? The FSH and LH receptor polymorphism, androgen secretory capacity reduced, decreased number of the functional LH receptors, reduced LH bioactivity, reduced ovarian paracrine activity, increased homocysteine concentration in the follicular fluid, decreased oxygen content of follicular fluid, and decreased mitochondrial energy production. So they all contribute for the poor ovarian response. Again, the studies have been supported the higher age with the higher genetic abnormalities in the female less than 35 years. About 60% of the embryos are expected to be euploid, and by 40, that is 30%, and by 44 year of age group is about 10%. The studies have been supported by the Damko et al. The journal in the Lancet journal, it is reported in 2016. Now all this documents the regarding this oxidative stress. Oxidative stress in oocyte quality is the possible etiologic mechanism involved in the minimal and mild endometriosis related to infertility. We can see in this reactive by inflammatory reaction, the increased reactive oxygen species production, decrease in the antioxidants, and oxidative stress causing the decrease of this oocyte quality, which affects the systemic, follicular, and peritoneal. So as we know, the timing of the follicle development, uh, how it is fast or slow, as it is a 18 follicle, after the 8 days of stimulation, better than one, it takes the 12 days. So the standard rate for follicle development, as we know, is about 1.7 to 2 per day within 10 to 12 days, being considered ideal. Oocytes from the follicles grown as these rates are better quality, higher fertilization, and more becomes blast. It is important to have the follicles to grow in a synchronized way, so that when the trigger is given, all of the most of the good size. Otherwise, they may find some immature oocytes, lower fertilization, and lower quality of embryos. So the good monitoring is also considered to be a very important factor. Among this, another very important for this oocyte quality is the lifestyle factor. I think is a very important in these days. The stress, the cortisol, the stress hormone reduces the estradiol, which is involved in the maturation of oocytes. Weight, yeah, increased body weight can lead to the changes in the hormone levels and insulin resistance, as well as the oxidative stress. The study has been supported by Ruder and Dropker. Again, by the Lancet et al. Has published one study they have done the study of more than 8,000 women and found that the women with higher BMI, more than 27, were likely 33% less likely to have a live birth compared to a woman with normal birth weight. Similarly, a study has done on the adverse effect of the smoking has been again supported by this Violin et al. That who found that the smoking reduces the odds of pregnancy and live birth rate by 50%, but did not see a difference in the miscarriage or fertilization rate. I think this is very common in the metro cities, especially I can say in the Pune, where the smoking and alcohol intake is very commonly seen. So I hope all of you agree with me on this, that weight loss is one of the cornerstone for achieving a healthy pregnancy and childbirth. So especially in the PCOS patients, the maintenance of the active lifestyle is very, very important. And as I mentioned regarding this is smoking and alcohol, because most of the girls are coming for this preservation also and wants a good oocyte quality. But 90% of the girls who are coming to me or the ladies who are coming to me, yes, ma'am, we are occasional drinkers and some are regular drinkers. So this all they have to change. In the alcohol, more than 4 drinks a week had a 16% lower chance of a live birth and 48% reduction in the fertilization. Again, the question comes on the diet. The Mediterranean diet, which is rich in fruit, vegetable, whole grains, nuts, olive oil, and low in red meat, it has been shown to have positive effect in the pregnancy rate. The study has been supported by the Braga et al. In 2015. The study has been reported. Now, to assess the egg quality, as we know, the day 3 FSH or estradiol, AMH, transvaginal ultrasound, and age plays a very, very important. So now how to improve the oocyte quality? As we know, this egg maturation and the target of the egg quality improvement, trying to improve the egg quality at the end of the month is a long process of egg maturation, is not as effective as intervening at earlier stages of this process indicated. We can see how this primordial follicle to primary follicles, secondary follicles, antral follicles, and how the ovulation. So yeah. So in this, the follicle interaction, as we know, first there is a pool of the primordial follicles, then which is committed follicles, antrum form with after this gonadotropin responsive follicles, and then gonadotropin dependent follicles, and then ovulation, and the ovulatory follicles come, and then the ovulation, and rest of the follicles will go in the atresia. So now what to supplement for this good egg quality? There are a lot of supplements, and every day in our OPD, we are getting the different company persons are coming to us that this is good for the egg quality. So the recent Cochrane review has been summarized a data on a variety of the supplements for improving the egg quality, and that includes for IUI, IVF, and timed intercourse. So many have been reported: N-acetylcysteine, melatonin, vitamin E, C, arginine, vitamin D, B, mannitol, folic acid, coenzyme Q10, L-carnitine, and pentoxifylline. So now role of mannitol in oocyte quality. So it has been, studies have been shown that mannitol is essential for maturation of oocytes, and its higher concentration in human follicular fluid is a marker of high oocyte quality. MI supplementation is positively correlated with the meiotic progression of the germinal vesicle oocytes by increasing intracellular calcium acylation. So myoinositol supplementation maintains a normal sensitivity to insulin in the ovary despite the systemic insulin resistance. There are a lot of studies in the favor of this. The studies have been published in so many journals. I have got this beautiful paper from International Journal of Endocrinology, European Review of Medical and Pharmacological Sciences, and Hormone Molecular Biology and Clinical Investigations. All they have given the conclusion that PCOS females with myoinositol supplementation showed the better fertilization rate and improved embryo quality. A higher number of oocytes were retrieved in the myoinositol group. The number of immature oocytes was also less in the inositol group, while in the placebo group, they have shown a higher number of the retrieved oocyte. Myoinositol and folic acid supplementation showed a better follicle retrieval group and more of metaphase 2 and more grade 1 quality of embryo. The lot of studies have been support in the favor of this. So this study has come, one more study has been in the favor of this, to how to achieve a high quality oocytes. What's the key role of the myoinositol and melatonin? This study has been published by Salvatore Giovanni. The study has suggested that these two molecules significantly improves the quality of oocytes and the quality of embryos. Melatonin seems to raise the fertilization rate, and myoinositol improves the pregnancy rate. Again, these studies, these two groups have been supported, these two compounds have been supported by so many studies have been found. So we have taken in this form, the chart form, that all have suggested that Pesti, Q, Briscoe, Kyoto, and Unifer all have supported that by use of this, improving the oocyte maturation, improving the follicular fluid, and increasing the number of good quality oocytes, and lot of studies in the favor of this. Even the studies have been reported that reduce the number of immature oocytes, decrease FSH requirement and day of stimulation. Uh, so there is one more study has been reported from the medicine journal. Inositol supplements improves the clinical pregnancy rate in the infertile woman undergoing ovulation induction for ICSI and IVF. The study has been done. They have done over the 935 women regarding after the use of this myoinositol, that how the results are coming. The study have shown that meta-analysis in the random effects in the model demonstrated that the proportion of grade 1 embryos were significantly higher in the myoinositol than in the control group. So this also study has been published. Again, this study have shown they have shown the proportion of the germinal vesicle and degenerated oocytes retrieved was reported in 3 trials, including 1186 oocytes, has been clearly shown in this graph. So this study have shown that the proportion of GVDG oocytes retrieved was significantly lower in the myoinositol group than in the control group. So there are a lot of studies in the favor of this. Again, this study have got today morning only. This has been supported by this International Journal of Endocrinology also regarding the support of this myoinositol and melatonin. Now, very commonly what we are using these days is the role of DHEA in the oocyte quality. The DHEA raises the androgen levels in the ovaries and affects the egg quality positively, leads to the improvement in the embryo quality, increases the IVF success, decreases the miscarriage rate, and decreases the chances for chromosomal abnormalities in the embryos. So again, the lot of studies in the favor of this, that how it helps in the diminished ovarian reserve. The studies have been conducted, and the studies have suggested that it improves the ovarian function, increases the pregnancy chances by reducing the aneuploidy, lowers the miscarriage rate. DHEA over the time also appears to be objectively improves the ovarian reserve. So studies have shown by this use of DHEA, the positive outcome, the so many studies in the favor of this, how it is helpful in the premature ovarian aging. The cumulative studies have been shown, this charts have been shown that how after giving this DHA supplement, how this is the clinical results are coming good. There are a lot of studies in the favor of this. Yeah, I think this is the same. There are these all charts in the favor of the use of the DHA and increase of this AMH has been reported. Now, other third component which has been reported is the role of coenzyme Q10 for the oocyte quality. The coenzyme Q10 restores the post-ovulatory aging, induced deterioration of the oocyte quality. Coenzyme Q10 improves the oocyte maturation competency of the post-ovulatory aged oocytes. It ameliorates the fertilization capacity of post-ovulatory aged oocytes and suppresses the oxidative stress-induced DNA damage and apoptosis of aged oocytes. So there are a lot of studies in the favor of this. This is from the Reproductive Endocrinology Journal, a very beautiful study which shows the pre-treatment with coenzyme Q10 improves the ovarian response and embryo quality in low prognosis young women and with decreased ovarian reserve. They have done a study, a randomized control trial study, which shows that pre-treatment with this improves the ovarian response to stimulation and embryological parameters in young female with poor ovarian reserve in IVF ICSI cycles. In this, they have seen the levels of basal day 3 FSH was significantly lower after 60 days of supplementation of coenzyme Q10 compared with the pre-treatment levels in the same group of the women. In contrast, the levels of AMH and AFC were almost identical before and after coenzyme Q10. So they have focused on these 3 parameters. This is study AMH and AFC and day 3 FSH. They found a significant reduction in the amount of the FSH. Yeah. Again, this study has been shown the coenzyme Q10 group had higher clinical pregnancy live birth rates with lower occurrence of pregnancy loss, and difference between the treatment and control group failed to achieve the statistical significance for each of these outcomes. So this based on that mitochondrial transfer to improve the IVF outcomes. So there are a lot of studies now in the favor of this also, that how to transfer the blastocyst from the younger patient to the blastocyst of the older patient. The studies can clearly shown. Uh, yeah. So in this, for this, the study has been reported by the Talley and Sinclair, which shows regarding this mitochondrial transfer, the poor IVF success rates in the female of the advanced maternal age reflects the unmet energy needs in the egg. So this has been shown the insufficient energy, the no fertilization or poor embryo development, failed pregnancy. Then augment IVF, that autologous germline mitochondrial energy. They have shown that to inject the mitochondria at the time of the ICSI and the egg to be fertilized, that got the sufficient energy, the successful fertilization and embryo development, which causes the healthy pregnancy. There's so many studies in the favor of this. Again, there is one study has been reported regarding the use of this L-leucine. I'm using so many of my patients this L-leucine and getting a very good results. In this, they have the change in the ovarian response and embryo quality after 90 days of L-leucine 800 mg therapy in the poor ovarian response patients undergoing controlled ovarian stimulation for IVF and ICSI. In this they have done the study that leucine is an essential amino acid and a nutrient signal that activates the complex one of the mammalian target of rapamycin. The association of this MTR is actually a brand name, a pathway in the folliculogenesis and in the involvement of the leucine in the regulation of this, and studied in the animal models, but no human studies have been available. This study has been published by this done in the Bangalore and done by this Kamini Rao Madam Center, the Milan Center also. It has been also reported. So yeah, by use of this L-leucine 800 mg for this minimum of 90 days, the study have been reported that it activates this rapamycin and it activates the protein translation and oocyte growth. The study is new, but we are getting good results. I have used in some of my patients, but I have used in the combination with DHE. I have not given alone L-leucine. So the study have been shown that after 90 days of therapy, the improvement of AMH, AFC, more retrieved oocytes and high quality embryos in poor responder displayed in the graphs. So again, there are a lot of studies before I conclude the DHEA. So as we all got the to understand that by this androgens increasing the response of growing follicles to FSH, DHEA either 25 mg or 25 mg TDS for 3 months prior to IVF, the fertilized increases the fertilized embryos and their quality, the cancellation rate decreases and improves the pregnancy rate, decreases the chances of miscarriage rate, and increase in the AMH has been reported. So the beneficial effects of that is increasing the egg and embryo counts and quality, increase the chromosomally normal embryos, increases the number of embryos for transfer in the IVF treatment, accelerated the time to pregnancy in fertility treatment, increases spontaneously conceived pregnancies. Again, what we IVF specialists are commonly using the testosterone gel also we are using, which increases the number of the small pre-antral antral follicle and the granulosa and theca cells. This has been also supported by so many journals of the fertility sterility. I am also using in some of my patients. Later on, we will take the opinion of Yashodhara ma'am also for this. Other thing which has been also reported is the growth hormone, which potentiates the effect of FSH, the 4 to 12 international units of growth hormone given subcutaneous starting on the day of the ovarian stimulation to get more mature M2 higher E2 levels and pregnancy rates. The disadvantage that it is costly. Yeah, the results are okay, I found. Yeah. So again, what is reported for this improving this poor oocyte quality and the poor responders is the recombinant LH has been also reported. Extra LH activity either from an LH drug or the small amounts of HCG may improve the follicle growth. In this, it has been reported in the literature from day 8. The dose is from 75 to 150 international unit. It has been reported to be beneficial more in the age group of 35 years, poor responders, and The study has been reported for this use of LH supplementation. There are a lot of studies have been reported, especially with the addition of recombinant LH, but it is again a very costly. Again, for improving the egg quality, the drugs have been reported, the L-arginine, aspirin, and sildenafil. Again, for this melatonin, there are a lot of studies from the PubMed has been also been supported for this melatonin as a new drug for improving the oocyte quality. So now for this poor responders, the age, oocyte number, and oocyte morphology all are important. So in the cases of the premature ovarian insufficiency, we are seeing so many patients these days. So before I conclude, there are some few charts I got it. So in this, the studies had been published that how this the incidence of poor responders increases with the increasing age group, and how after supplementations of these the results are coming good. So the studies have been shown. I will show that in the last the chart that how after the supplementation of these the implantation rates and transferred embryo are becoming better after giving these supplements. So with this, the viability of oocytes in poor responders is especially poor when it is associated with increased maternal age, more related to the limited possibility of performing the embryo selection rather than to a compromised viability of the oocyte itself. No morphological aspects are particularly relevant in the oocytes generated from the poor responder patients. Again, what is recently, I thought I must include for this because this is a very recent, and so many patients are these days are all are coming and approaching to us via Google. Say we all ask about the recent things that the ovarian stem cells injections has been also been reported autologous stem cell ovarian transplantation to increase the reproductive potential in the patients who are poor responder. The study has been supported by the in the fertility study journal in 2018, in which they have shown the ovarian infusion of the bone marrow, of the bone marrow derived stem cells. The conclusion of this study, the escort one study, has been reported, which shows the improved follicle and oocyte quantity, enabling the pregnancy in the women who are poor responders with the previously limited to oocyte donation. Now, how to prevent this? So, the ovarian reserve is screening before the contraception. Ovarian reserve is screening in all the infertile patients. Now, what regarding this PCO drilling and repeated endometriosis surgery and egg freezing? So, please do not do this repeated this extensive use of electrocautery also is damage, and more drilling is also damage. I have seen the some patients who are coming 2 to 3 places that laparoscopic has done and for the drilling has done. So it is more harmful compared to this. As Veera ma'am has just before starting the webinar discussing, but that most girls are coming the delay in the age of the marriage and all are asking for this the egg freezing. So as we know, this Apple and Facebook are providing to their female employees, they are paying to freeze their eggs. So they are a relatively new practice of freezing the eggs, which allows the woman to put their fertility and on hold so that they can still have the children later in their life. So the take-home messages are the number of oocytes is a key factor to maximize the clinical live birth rate, and it must be optimized according to the ovarian reserve of the patients. Luteal phase stimulation gives the competent oocytes with live births. In a low prognosis patients, duostimulation can maximize the number of oocytes per menstrual cycle, increasing the chance of obtaining the embryo that can give a live birth. That could be applied in all patients with little fertile time left available. So individualized approach seems to be ideal because there is no something like tailor-made protocol. With every patient we have to decide so that how the patient is responding to the protocol, what's the diagnosis we have to keep in the mind, the endometriosis or the PCOS, and what's the age of the patient, weight of the patient, and what are the risk factors associated, and what's the history of the previous, and how the patient responded earlier, and what's the very important is the affordability, because in our India this is not coming under this insurance control. So this is also very important. We have to keep this also in our mind. So I think I will wind up with this because the topic is so wide. I will try to conclude as much as possible. So, thank you overall for the patient listening. Thank you so much.
Yeah. Thank you, ma'am. Thank you very much for your excellent and superlative talk. It is always an honor and learning to hear you, ma'am.
Thank you, Dr. Sameshwar. Thank you.
Yeah, I request our honorable dignitaries, Dr. Yashoda Madam, and our
Dr.
hello,
Ritu,
Yes, ma'am.
hello. Yes, ma'am.
uh,
Yeah,
uh,
our guest of
I
honor.
just was wondering, we always talk about poor quality. There's some factor of like poor sperm quality also, isn't it? But I think, but we do not talk more about it because sperms are millions and millions in number, and whereas eggs are during the birth only they are 1 or 2 million, isn't it? So I think we don't talk about it much.
Agreed, ma'am. Ma'am, we will do one program for this male infertility also. Yes, there are a lot of patients are coming these days. Today only I got one patient. The patient told me ki ma'am, I to get all this Google savvy patient. Patient himself
Hmm.
has done the DNA fragmentation also. I told him who advised you. No, no, I have read in the Google. If my sperm count is less, I have to go for this DNA fragmentation.
And
So
are you using PRP for these oocyte qualities?
I'm using, ma'am. I'm
Okay,
using, ma'am. Yeah, I'm
okay,
using.
good. Thank you.
Y-
वी विल टेक द ओपिनियन ऑफ यशोधरा मैम बिकॉज हमने जो इनफर्टिलिटी सीखी जब हम एमडी कर रहे थे यशोधरा मैम वाज आवर रोल मॉडल मैम स्टिल इज आवर
Hmm.
रोल मॉडल क्योंकि मैम ही करते थे उस समय सब कुछ हम लोग बाहर से पहले झांकते रहते थे कि हम लोग की कब ड्यूटी लगेगी मैम के साथ में आई स्टिल रिमेम्बर कि मैम ही सबसे पहले प्रोटोकॉल्स बताते थे तो वी ऑल वेट मैम योर एक्सपीरियंस विद द टेस्टोस्टेरोन जेल यशोधरा मैम
Ritu, there was a time when I was really in for the infertility. And then, public hospital has got its own problems and limitations. So
yeah
there's some politics has happened.
true
So I thought there's no point to go that obstacle.
okay
So I still remember the trivector and this thing, Shivani people used to come to Lucknow to establish anybody's this thing. And they used to say that, Madam, it will be a pleasure to establish your IVF lab. I said, this will not going to happen because it was not possible to do both the things. And but testosterone gel, I do not know because I do not have any personal experience, but I want to know it is still available and it is being used uh, to these women. In fact, I would like to say I would suggest, in fact, Ritu, you must have your some platform in which you can do a public awareness
ma'am I'm
because
doing
public
ma'am
is very important. The Google
huh.
they are reading, as you have said,
Yes, yes, yes.
because they do not have any other platform.
Hmm.
If it comes from I'm sure that your clinic must be having the pamphlets about all these things. You are displaying those.
Ma'am, in the Pune, all are mostly the tech savvy. So we are doing all this Facebook, Insta, all that we are doing. Ma'am, पेपर यहाँ लोग लेकर नहीं जाते आजकल तो कोरोना की वजह से मैम जो कंपनी
Nee,
वाले
but
भी
to sit
yes
and
yes
read,
yes
sit
yes
and
yes
read,
sit and read yes
sit
ma'am we
and
are
read.
doing yes
Or
yeah
the some TVs running around.
yes
So
ma'am
at
that
least
yes yes
so
ma'am
those who
that
can learn from there because it is in the Pune, na. But in
yeah
the inner side,
true
in
huh
the down the Pune.
true
So in
ma'am
the
true
peripheral reasons, people do not know, and then they go to some other people and they lose their 2 3 years, and
hmm
then they come for this higher this thing. So I did not use personally any patient with the testosterone gel,
okay
but I would like to know from the other audience that they have used and how is the response and is it available with what name because I'm not aware of it. So I just want to
I'm
know from
yeah
Dr.
yeah
Veera and Dr. Ritu.
yeah
Even I don't know about
No, no,
it.
Veera ma'am, I am using, ma'am. It is coming from
Okay.
Intas and some other companies also with the name of the Androgel. So
Hmm.
I am using in the patients because in some patients, if we give this oral DHA, patients are getting lot of side effects, lot of acne. Some are complaining. So in some patients, और कुछ लोग ऐसा बोलते हैं कि हमें टैबलेट लेने के बहुत प्रॉब्लम हो रही है, तो I am using in some patients this testosterone gel, especially in the poor responders. I start 2 cycles before only. So it's
So
come
how
in
do
the,
you give?
ma'am, this is coming in the pump form, and in the gel is coming with the spray form of bottle. So we have to tell
Daily, daily.
yes, yes, daily, daily, daily. हाँ, तो one actuation जो होता है उसमें 1.25 निकलता है, तो we tell the patient to apply once daily.
So the
Once
dose is
daily.
regulated.
So it has to be rubbed on what are the surface to be used for
Ma'am,
this?
non-hairy portion the patient has to apply, and minimum 60 actuation निकलते हैं one bottle में, and then we tell after the bath the patient has to apply, and that should not be बहुत strongly rub नहीं करना है, that should be automatically so अपने आप absorb हो जाना चाहिए. I am using, ma'am. I can share you
So
some
it is the
videos.
abdomen and the medial side of the thighs.
Yes, ma'am. Yes, ma'am. Yeah, yeah.
So so you allow them to wear the clothes once it has been dried
Yes, ma'am. Yeah, yeah.
after
Yes.
the bath,
After the
dry
bath.
and then
After the
apply, and
yes.
then they should do this.
Yes, 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 yes.
And
No side
how
effects
many
have we
months it
seen.
has to be used? 2 months.
Ma'am, I'm using 2 months. Ma'am, the literatures have supported, some studies have shown कि only the 21 days prior also give the good results. But clinically, I have not found. मैंने 2-3 patient में try किया, but 3 patients recently have tried for 2 months. So I found the very good results with them. Yeah.
Okay.
Veera
So
ma'am, you
and
are
then
saying
you
something.
start with your cycle.
Yes, ma'am. Yes, ma'am. Yeah, yeah.
Accordingly, you
Doc-
choose long cycle, short cycles, or whatever you have to
Yeah,
give.
yeah, yeah. Yes, ma'am. Yeah, yeah.
And you have
Dr.
found
Ritu,
good
but
results.
sorry,
Yes, ma'am.
Dr. Ritu, but we are using so many iron supplements which have got all these factors, all these ingredients, DHA, CoQ, and all macronutrients and everything. So we have not come across any side effect with those.
Ma'am, that is DHA, and this is DHEA.
Yeah,
This is dehydroepiandrosterone, ma'am.
happy
So
understand.
yeah, yeah. So ma'am, this
Yeah,
is
yeah,
little,
yeah.
ma'am, with some patients.
Sorry. That,
No, no
yeah.
issues, ma'am. No issues, ma'am. So
Hmm.
with some patients, I find this like that. Some patients are complaining of lot of oily skin and this. So uh,
Okay.
in some patients, I find, and some patients are
Acne and
very,
other
yeah,
problems.
and
Yeah,
some
Yeah.
yeah,
patients
that is
are,
what
yeah,
acne
and
and extra hair growth and
yes,
Ah,
something.
ma'am. Yeah, ma'am. Yes, ma'am. And some patients are very much reluctant to take the lot of tablets also. So in that
yeah.
patients, I have used in some patients.
So
Yeah.
you
So
people are
testosterone
using
doesn't come in the tablet.
progesterone
I
gel
don't think
also?
so. Is it coming in the form of tablet?
What, ma'am? Testosterone.
This testosterone?
Ma'am, testosterone gel. Yeah, testosterone tablet is also coming with some by some companies, but that I have not used. I have used only in the cases of the male patients. That this I have not used for this poor AMH. I have not used the testosterone tablet.
Sorry,
And
sorry to interrupt,
huh,
Ritu.
yes, sir.
Testosterone tablet has a Professor Yasodharaji wonderful result. I have read one article
Okay.
when one of the lady gynecologists herself in
Mm-hmm.
USA took testosterone tablet and her all problem has gone. It's a wonderful drug, I tell you. And what Ritu saying, Maya is say, this all COQ and all
Uh-huh.
everything is helpful to improve the oocyte quality. I agree with Ritu.
Yeah,
Okay.
yeah, yeah, yes, sir.
Dr. Ritu, you have congratulations. You have covered everything beautifully. And
Thank you.
what is your experience like the ladies who come for the egg freezing, oocyte freezing? So is it very frequent they come to you for freezing of eggs?
मैम these days the incidence is increased. पहले लोग इतना नहीं आते थे, but now from last 2 years I have seen the incidence, the lot and lot are coming. Mostly I am getting some of the corporates and some the doctors. So many doctors are coming. VHMS, VUMS. These doctors are coming these days for the egg freezing. कि we need some time now. These days, lot of doctors are coming for, especially for this. Yeah.
And what is the result of this egg freezed oocyte?
Ma'am, till now the results are good, nothing like that. Till now we are getting good results. Of course, the pros and cons are there. We tell the patient everything. Yeah.
Dr. Supriya, it is only 1 to 2% less than the normal oocyte when we fertilize in IVF. It is as equal as fresh oocyte. I think not much
Okay, good.
difference. Maybe
In
one or
fact,
two
the
percent
chances
less.
of infection and everything has gone once you have freezed it
Yeah,
True,
yeah.
true.
because the window period has gone for
But
any
lot
sort
depends
of
on
these
the
infections.
temperature maintenance,
Yes,
in
yes,
these.
yes,
Yeah,
ma'am.
yeah.
Yes, ma'am. Yes, ma'am.
So you freeze the oocytes or you freeze the ovaries also,
No, ma'am.
part of the
Ovary.
ovaries.
No, no, ma'am. Ovary freezing, I have no experience. Oocyte,
Uh-huh.
I know, and embryo freezing, I know. What I am doing, that
We
I
will
can say.
we will
Yes, yes.
start shortly, madam, in Pune. Yeah?
What,
Ovary freezing.
what, sir? What, Rajesh sir?
You will start shortly ovary preservation in Pune. In this.
नहीं 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 oh नहीं नहीं ovarian preservation I have no experience.
Ovarian
Ovary,
transplantation, tissue
Dr. Vinit
transplantation is
Mitra,
also
madam.
there.
Yeah, yes, yes,
Dr.
yes, yes, yes,
Vinit
sir.
Mitra has taken ovary and put it in this arm
हाँ हाँ
here.
Vinit sir, yes, yes, Vinit sir,
Yeah, yeah, yeah. And
yes, yes,
yeah, he has preserved ovary, and from that also he has some miracle results.
yes, yes. I have gone to
Yeah,
Vinit sir for the same training. I have done the training, but till now
yeah.
I have not sufficient data to say means कि I have a good experience on that.
So Ritu, I just put a simple question
Yes, ma'am.
in the chat box that many women, you see that you must be coming across every day, that they ovulate but they do not conceive. So
Mm.
at the end of the day, once they have done everything and then they say that, madam, why I did not conceive? So what are the explanation you put through?
Ma'am, no, no, very, very nice question. Na? Very, ma'am, I think you are the best judge to give the answer for this. So all of us will be get benefited by your immense knowledge.
No, I just want to know because
Huh.
every day this is happening. So I know that lots of problem could be in the sperm functions and the ovarian functions and in the implantation and the fertilization. So, but
Ma'am,
uh,
mostly what my approach for test offer means whomsoever I am starting the infertility treatment for my, I always explain the patient that age, AMH, and AFC three I will means decide by this three first. And according to this male also I am doing the semen analysis and semen culture also, yes. And some patients I am doing this thyroid and LHFSH prolactin also. These things I will do must. Yes, you are very correct, ma'am. The some of the patient despite having everything okay is not getting the implantation is done, very correct. So sometimes later on we do the progesterone study also we do in the patients. One patient of mine, her everything is normal. Even the patient told me that she want to do this anti-sperm antibody. That is insisted by the patient that she has read somewhere in the Google that वो हर महीने में आती है उसके साथ में जो पेशेंट आते हैं उनका टेस्ट पॉजिटिव आ जाता है उसका टेस्ट पॉजिटिव नहीं आता दैट पेशेंट ओनली इंसिस्टेड मी मैम एक बार आप मेरा एंटी स्पर्म एंटीबॉडी करा लो तो वी हैव डन दैट आल्सो कम नेगेटिव but still she is not pregnant, she is with me from last 6 months.
so what
Huh.
do you suggest that these people are going to be better with the oocyte freezing or something better results? Do you feel that IVF is a better choice than this thing?
Yes, ma'am. I think so. I always tell them, but later on, the patient has to. Yes, if more than 6 cycles have gone and patient is not getting the result, I think we must go for this IVF or ICSI, whatever is needed accordingly.
And you find that they conceive with
Ye-
IVF.
Yes, ma'am. Compared to but I am getting the IUI results also very good. I can't deny that
See,
also.
I just say in these type of the cases
In
who
this.
have not conceived, so the results of the IVF is better
Yes,
Comparatively, yes, better. Yes, ma'am. Yeah.
because of the controlled selection of the oocyte and
Oocytes.
controlled selection of the
Yes.
sperms.
Yes, ma'am. Yes, ma'am.
And
Yes,
you can
Supriya, ma'am.
watch that fertilization has occurred or not.
True, true, ma'am.
like
True, ma'am.
patients who are young and who have got everything okay, I think IUI also gives a very good result in the first 3 cycles itself.
Of
Yes,
course,
yes.
but I'm just talking those who do not conceive
True,
with
true,
IUI. Of course,
true.
everybody probably tries in the young patient the timed intercourse and then IUI, and then if does not this thing, then go for the
Normally,
IVF.
also, ma'am, during
But
counseling,
nowadays,
yeah.
sorry. nowadays people say we do not want anything. We just want a IVF because we do not want to waste time.
Hmm.
Yeah.
If we have planned this year is going to be our pregnancy, so if I am not going to be this, then I have to be this thing. So it is better that I take 3 cycles of the IVF instead of 3 cycles of the timed intercourse and the 3 cycles of IUI and then lost the time, and then three
Yeah,
cycles
they
of
are
IVF.
coming. They are already coming late, madam. So they are not
Yes.
Yeah,
taking.
they are
Yeah.
coming late.
So,
But
Mm.
ma'am,
and they just
still
plan
the
everything, na?
yes, yes,
This
yes,
is the
yes.
year in which they want
हाँ,
this thing,
yeah. मैम
the
still the
child.
myth in the public's brain कि उनको लगता है कि IVF कराएंगे तो उनको 100% प्रेगनेंसी होनी ही
हाँ
होनी
वही
है,
हाँ,
उनको ऐसा लगता है
Guarantee.
हो जाएगा
होनी ही होनी है, मतलब फिर
like
मैम
that.
हमने इसलिए तो IVF कराया था क्योंकि 100% प्रेगनेंसी होनी है। अरे तो
So
हम
the
कब होते हैं?
counseling,
Yes.
you are counseling them so that
हाँ,
what the result of the IVF, you know.
Means
So
patient,
I mean to say, but there's an improvement in the IVF results. There's no doubt about it.
Yes, that's
So
true.
what is the
But
success rate, Ritu, nowadays for this?
ma'am, I'm getting 50-60, 50-60.
50,
Yeah,
60 conception or the take home baby
take home
rate?
baby, ma'am. Take home baby. Yeah.
Take home
Yeah.
baby rate.
Good
Yes,
enough.
yes, yes,
Good
yes,
enough.
yes, yes.
Mm.
Yeah.
50-60% in how many cycle?
Minimum 3
Not like
cycles.
that.
Minimum 3 cycles, not in one cycle.
Okay,
Minimum 3
three cycle,
cycles. Minimum
50%
3.
is okay.
We have to tell the patient the minimum 3 cycles. Yes. पहले हो जाएगा तो is more good. Yeah.
अभी अभी तो मनी बैक भी आ गया ना
मनी
100%
बैक
मनी
सर मनी बैक नहीं आता हमको करने को
No,
out
no,
there.
but
Yeah.
in one cycle you just freeze the oocyte and the same oocyte or embryo is been
Yeah,
used for
yeah.
the next 2 cycles.
Yes. Embryo freezing, ma'am. I'm doing in that patients. If I get the good embryos, I do the embryo freezing. That patients.
So they don't have to, they only endometrium preparation has to be
Yes,
done to
yes,
them.
Yeah.
yes, ma'am. Yes, ma'am.
And what are you using for endometrium preparation at the moment?
Ma'am, I'm using everything. My favorite is PRP. I'm using so many patients this PRP means estrogen, whether sildenafil. I have done we have done very nice webinar with Veera ma'am. All the sildenafil, very good results we are getting for that arginine. Everything we are using, ma'am. And if ultimately the result is not coming, I am using this PRP. PRP is giving very good results.
Yes, that is what we have
Yes,
heard.
yes, ma'am. Yes,
PRP is a good thing.
yes.
So it was a
Stem
wonderful, very informative webinar, Ritu, by you. It's a very difficult topic and never-ending discussions are there.
True.
But it was really wonderful to listen to you. It was
Thank you,
very
ma'am.
wonderful.
Thank
So
you,
may
ma'am.
God bless you.
Thank
Thank
you,
you, ma'am.
Ritu. Thank you once again for inviting us and being a part of it. Really, thank
Yes,
you.
it was our pleasure.
Yeah.
Thank you,
I
Dr.
think so
Neetu, and salute to Dr. Yasodhara ji, Dr. Supriya, and Veena ji. I was very happy to share platform with you people. Okay. Wish
Yeah.
you a very
Same as
sweet
sir.
dream. Good
Same
night.
as sir.
Bye bye.
Yeah,
Bye.
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 Thank you,
Same
everyone.
for
Thank you,
me
Dr.
that
Ritu.
I am honored to share because of the Ritu. I could share all platform with all of you.
Yeah,
So
nice
I
Yes,
meeting
was
yes,
you
yes.
also,
Same.
ma'am.
Yes.
Yeah.
thank
Dr.
you.
Thank
Riti, thank you once
Thank
again.
you.
Very
Ma'am,
so,
the
nice.
program
so we
has gone
take.
live on the YouTube, so all of you can see on the YouTube. It has not gone on Facebook. It
Okay.
has gone live on YouTube. So everything conversation is on the YouTube.
Okay.
So yeah.
So,
Okay.
so we say goodbye, good night, Hannah?
Yes.
Good night.
Yes.
Yeah. Thank
Goodbye.
you.
Yeah,
Okay.
thank
So
you,
Thank
ma'am.
you. Bye bye.
Thank you
Thank you
to
so
Shield
much, ma'am.
persons also, Dr. Someshwar and Dr. Prachi.
Yeah,
Big thanks to
person,
you.
yeah. Thank you very
Yeah.
much.
Thank you, madam.
Thank
It's
you.
always our honor and privilege to have you all here, ma'am.
Yeah.
And thank you,
From
many thanks
Lucknow,
for
there are
your
2, 3
time.
people, Smita, Deepa Kapoor, all have joined.
And ma'am, rest must have joined from YouTube. Most of the doctors are joining these days from
Not a
YouTube and
bit very.
Facebook. Yeah.
Yeah,
Yes.
it's very easy to join to that alone.
Yeah.
Yes.
Yes.
Okay.
I've been
Thank
seeing
Okay.
you.
you many
Thank you.
times, Dr. Riti.
Sometimes come and once the COVID gone, only then we can invite.
Yes,
Yeah.
ma'am. Yes. Okay.
Thank
Okay.
you.
Thank you. Thank you,
Thank
Veera
you.
ma'am. Thank you, Supriya
And
ma'am. Thank you,
thank you,
Rajiv sir.
Veera. Thank you, Supriya.
Bye,
And thank you,
bye.
Dr. Rajiv Vyas,
Uh, Thank
for
Yeah,
this is the
yeah.
platform in which we met, at least face to face.
Yeah. Indoor mein, our All India conference will held in June most probably if COVID goes. So we will enjoy the AICOG. in Indore.
Okay, I was just thinking to call somebody to find it out. It is in the June 2021.
Yeah. Most probably, if COVID permits, it will be end of the June, madam.
End
Yeah.
of the June. Okay, chaliye.
That is the
Good
latest
news.
news I have. Yeah.
Good news. At least we are going to
Okay,
meet
yeah.
sometime.
Yeah.
Okay. Thank you.
Yeah.
Thank you,
Okay.
everyone. Thank
Okay.
you.
Good
Thank you.
night.
Thank you,
Okay.
Yashoda ma'am. Charan sparsh to you, my teacher.
Arey, thank you.
Yeah.
You too. You are
Okay.
Bye, Dr.
such a
Meera.
lovely thing.
Yeah.
Okay. Bye.
Okay.
Thank you, ma'am. Thank you,
Bye.
Dr. Ishadara,
Bye,
ma'am,
Dr.
and
Ritu, once again.
Dr.
Yeah.
Raju
Welcome,
Vyas,
ma'am.
Dr. Supriya Jaswal, and Dr. Ritu Santwani, ma'am. Thank you, and thank you, Dr. Supriya Jaswal, ma'am. We are privileged to have you all here, and many thanks from the Shield team, ma'am.
Okay.
Okay.
Yeah.
Okay.